Thank you very much, Lisa.
Thank you, Jack. So I'm going to go ahead and kick off the webinar, and then I'm going to introduce you. So we're really pleased to have you with us this evening. As I mentioned, tonight's webinar is Federal Public Health Career Opportunities. I'm Lisa Cook, Director of Career Services, and I will be your moderator. Recently, we delivered a webinar on career opportunities in public health, which featured Walden faculty discussing various positions available to students at the undergraduate, master's, and doctoral levels. Many of our students are interested in opportunities specifically with the federal government, so this webinar is tailored specifically for you. This webinar will give a great overview of the federal hiring process with an eye towards public health careers. Now, before we get started, I will ask Dina Berggren to run a brief poll to learn more about our audience today.
Thank you, Lisa. Before we get started with the presentation, we would like to find out a little bit more about who is with us on this webinar today. So who is joining us here today? Let me see here. What degree are you pursuing? Bachelor's, master's, doctoral? Are you an alumnus or other? So let's give it a minute and we'll see what the results are. Okay, so it looks like 60% of our attendees on this webinar are in doctoral programs, 29% masters, 8% bachelors, 10% alumnus, and no others. So this captures everyone who is on the webinar today.
Great, thank you, Dina. Now I'm going to go ahead and introduce our expert presenter this evening. Dr. Jack Nemechek is a public health advisor with the Centers for Disease Control and Prevention in Atlanta, Georgia. He is currently assigned to the National Center for Immunization and Respiratory Diseases, where he works as the Deputy Branch Chief for the Education, Information, and Partnership Branch. He has been supporting the immunization program since 1995. Dr. Nemechek is also a retired naval officer, healthcare administrator, having completed a 22-year career on active duty. Dr. Nemechek is also a lead faculty member here at Walden and has taught here since 2009. He has a PhD in public health and an MBA in healthcare administration. And personally speaking, he's married with 3 sons and 4 grandchildren and resides northeast of Atlanta, Georgia. So with that, I'm going to hand it over to Dr. Nemechek, who will be discussing our topics for today. Jack?
Thank you very much, Lisa. Hello and welcome to Walden University's webinar on federal career opportunities in public health. I'm Dr. Jack Nemechek, and it's a distinct pleasure being able to speak with you about a topic that is important to all of you who are pursuing degrees in public health, and that is how to get a job with the federal government. The objectives to be achieved in this presentation will include some background and history of the federal hiring process. We'll talk a little bit about why working for the federal government is a good option, and we'll talk about things like, am I eligible for positions that are being advertised, and how the federal application process for hiring works. We'll also talk about what you might expect relative to the interview process, the importance of networking and establishing valuable contacts, and suggestions for staying updated on public health trends and hot topics. Now let's move to our first objective, the background and historical perspective of the federal government hiring process. Next slide, please. Up until just 2 or 3 years ago, the federal hiring process was still a hodgepodge of numerous electronic and paper-based systems. Agencies did their own advertising and recruiting, and every agency used different forms and questionnaires and had different requirements for applying. Some agencies accepted resumes, but some didn't. The biggest challenge of all was the use of KSAs, known as knowledge, skills, and abilities. This was the one common denominator that all agencies seemed to have. KSA guidance about what they were and how they were expected to be written was a mystery, and many people would not even finish applying for a job because of their frustration with developing their KSAs. It was a daunting task to apply for a federal job, to say the least. Then in 2010, the Obama administration announced a presidential directive to all federal agencies to revamp the federal government hiring process and mandated that everyone start using USA Jobs as the one and only electronic application process. USA Jobs had been around already for several years, but not everyone used it. In fact, most federal agencies did not. Now that they are, and as a result, the entire process is a little easier to navigate, understand, and hopefully be able to land a job. KSAs have now been eliminated completely and are no longer required as part of the application process. KSAs may be asked for by an agency after you make the final cut for a job, but this practice is becoming obsolete as well. In short, the entire process is now fairly streamlined, standardized for every agency and application process, and extremely user-friendly. Next slide, please. So you ask, why should I work for the federal government? Well, the federal government offers many opportunities for meaningful, challenging work with a broad impact. Secondly, the pay is very good. Entry-level positions for bachelor's degrees generally hire on at the GS 9 to 11 range. Master's trained individuals hire generally at the GS 12, 13, or 14 levels. And doctoral level candidates generally hire in at the GS 14 or 15 level. Now you can actually see what those pay grade scales are by accessing the link that is there on your slide in front of you. That is an Office of Personnel Management link that has all the salary tables there, and you'll be able to find not only the tables for 2012, but what the starting tables will be for 2013, which is October 1st of 2012. Another reason why you might want to work for the federal government is we have very flexible work schedules. It's possible now that you can expect to work almost any schedule that is convenient to you and your personal lifestyle. That is within reason. We promote teleworking. We also allow people to work from home on various occasions for different reasons. And this is a very popular option that people have available to them almost everywhere throughout the federal government and is being promoted widely. This is, of course, conducive to your type of job and the location where you work. Benefits are also very good, like health, dental, and vision insurance. They're provided with a cost sharing between whoever your agency employer is and the government, with many good options to choose from. Additionally, vacation and sick time are accrued hourly depending on your years of service. There are even opportunities to access paid continuing education for your professional development, with most agencies giving a set amount of funding to spend in your own individual learning account, or ILA. In some instances, depending on need and whether or not your job offers it, there may even be an opportunity for the government paying a portion of your student loans. Now, perhaps one of the most important benefits is that of working for the federal government, providing tremendous job security and the ability to move around if you desire to do so. Particularly as a public health advisor, which is the job category that I work in, you may have the opportunity to move from state to state or even overseas as new opportunities become available. As you can see, becoming a Fed can be a pretty good deal that can provide you with many years of exciting, professionally rewarding years of employment that is hard to beat anywhere. Now let's talk about your eligibility to become a Fed. Next slide, please. Working for the federal government, especially in public health, can be very good for you professionally for many reasons. First of all, there are numerous federal government agencies that fall under the responsibilities of the United States Department of Health and Human Services, or HHS. There are agencies that can potentially employ someone with a public health degree. There are no less than 11 agencies with that potential hiring power. You can visit the U.S. Department of HHS at the web link listed there as www.hhs.gov to see who these agencies are and what their particular focus on health is all about. Whichever agency you would like to work for, you will find meaningful and challenging work there for the degree, what your degree has prepared you for. In that slide that you have there in front of you, you can see some examples of what some of those operating divisions are. We have the Administration for Children and Families, or ACF, the Administration on Children, Youth, and Families, the Administration for Community Living, Agencies for Healthcare Research and Quality, the Centers for Disease Control and Prevention, and CMS, the Centers for Medicare and Medicaid Services, just to name a few. So when you get a chance, please visit that link to see how many of these agencies there are and what they have to offer you. Next slide, please. So again, am I eligible? When accessing job announcements for federal government employment, make sure that you read the announcements carefully, as each one of them have lots of very detailed information. Key parts of each announcement are who may be considered for the position or who may apply. Announcements may also define other key criteria or areas of consideration. Each announcement will have the name of the hiring agency, the name of the position by grade and job series number, and then the types of candidates that they will accept applications from for any particular job. Next slide, please. To start with, you should become familiar with these three types of eligibility categories which most announcements will advertise. Typically, the announcement will state that those eligible to apply will be either a status candidate or a non-status candidate. Status candidates are those that currently work for the federal government, and non-status are those who do not work for the government. There are also special hiring path candidates that can be considered for some job announcements as well. Regardless of what category you fall under, make sure that you are applying for something you're qualified for. Otherwise, the time you spend applying will be wasted. For example, if you do not now work for the federal government, you do not want to be applying for a job announcement that is advertising for status candidates only. Next slide, please. As I mentioned previously in the last slide, special hiring paths can be individuals with disabilities. These have to be documented by a healthcare provider. Military spouses, restored federal employees, that is, those who have been previously let go but are eligible to return to federal government employment. Students and recent college grads, and that's the category that most of you fall into. Veterans, some people might be veterans out there that are listening in tonight. And anyone who has served in the Peace Corps or VISTA programs. Again, the federal government job announcements may target these special hiring paths, but just because the announcement doesn't specifically identify these special hiring paths in the announcement does not mean that these individuals will not be looked at. So make sure that you apply for anything that you might be eligible for. Potential employees who fit into any of these special hiring paths are encouraged to apply for any job announcement that they feel they're qualified for by either education and or experience. Next slide, please. Now, before we move into the actual steps to apply for employment, one last word about employment types and job categories. As this slide depicts, there are at least 6 types of job categories for you to consider, which includes everything from full-time permanent to part-time temporary, etc., as you see there on your screen. So be aware that there are many options to fit what you might be seeking at this point in your life. Now let's move to the real nuts and bolts of applying for a federal job. Next slide, please. When you apply for using USA jobs, have a realistic expectation of the timelines that will apply. Hiring on as a Fed can take several months. There are exceptions, but sometimes people luck out and get an offer of employment within weeks. But that is generally not how it works. So be prepared for a long wait, hang in there, plan ahead accordingly. Once you register with USA Jobs, make sure you take the time to build multiple resumes in the system that you can use to target certain jobs. USA Jobs allows you to build and store up to 5 resumes, and you can modify them at any time. Next slide, please. As you are now aware, USA Jobs is where you will go to apply to multiple agencies. As I mentioned, HHS, or the Health and Human Services, has numerous agencies under its umbrella that employs people with degrees in public health. The most common job category will be that of Series 0685, or Public Health Advisor or Analyst. However, you can find numerous job categories related to epidemiologist positions, health scientists, and things of that nature. All of them can be found by searching USA Jobs. So now let's take a look at the system and see what you need to do to get started. Next slide, please. The screen that you see there before you is the very first screen that you'll see when you access USA Jobs at www.usajobs.gov. And the first thing that you want to do before you start searching for jobs is take a look in the upper right-hand corner there where that red button is that says Create an Account. There you click on that button to create an account, and it will take you to another page where you'll be able to start filling in information. It will walk you through the process. But take a look at the left side, the upper left side of the screen as well. The navigation links up there will take you to the home page for USA Jobs, the search screen, the section called My Account, where your resumes will be stored, and a resource center. I strongly suggest that you visit the resource center first to see how many options USA Jobs has for you to use for your job search. It is very comprehensive, and I think you'll find it invaluable. Now, toward the center of this page, when you first log on to the words USA Jobs, you will find search boxes. You can search by job title and or location. You can hit the blue Search Jobs button and you're on your way. Notice also that just below that blue search button, though, is information for selecting hiring paths for people with disabilities, veterans, students, or recent grads, and information about the Senior Executive Service. Next slide, please. Now, after you create an account, this is the next page that you're going to see. It's important to be patient as you complete the information on this system. The more thorough you are in filling out the information, the better your luck will be in having potential hiring managers seek you out. This information is the first thing that hiring managers will see, and you can only make a good first impression once. So make sure your information is complete and represents you in the very best possible light. Next slide, please. Now, after you complete your resume, click on the Advanced Search button. The Advanced Search will enable you to conduct searches using keyword search using job titles or agency names or both. Or you can use title search, where you can type in terms like public health advisor or public health analyst or epidemiologist or health scientist. Or you can go to the pay grade salary range search and look at things that are for GS 9 through 11 or GS 12, 13, 14 or GS 14, 15. You can also do a location search by state, territory, or regions, depending on where you want to work. And lastly, by agency, such as jobs that are listed under the Health and Human Services, and in my case would be for the Centers for Disease Control and Prevention. So you have a plethora of information there that you can pick and choose from. You can use all of these search mechanisms, or you can use one or the other, or use just several of them in conjunction with each other. USA Jobs can even be programmed to send you email notifications anytime a certain type of job announcement is released. So again, visit the Resource Center to figure out how to do that. Next slide, please. Now, some more tips about the application process. Make sure that you seek out help from someone that can act as a mentor on your behalf, who's familiar with the process and can advise you along the way. I seriously advise you to take this under consideration, because it will save you tons of heartburn and help you to be more successful at navigating this process. Make sure you build multiple resumes that will allow you to target specific jobs. One resume will not fit all jobs that you're looking for, and that's why you've got an option to build up to 5. Remain optimistic. Have your mentor help you select appropriate positions so that you devote your time and energy to applying for positions that are actually within your reach. Remember what I said, that it's possible that you would be applying for things that you don't qualify for, but if you enlist the help of a mentor, you probably will avoid that problem. Next slide, please. Remember that this is typically a very long process. You may need to apply for numerous jobs before the right one finally comes along and you receive an offer. Make sure you stay updated on current vacancies. The easiest thing to do is program the system to send you automated notification of job postings. Otherwise, visit USA Jobs on a regular basis to see what else is being posted. New jobs are in fact posted every day of the week, so make sure you don't miss out on any of them. Also, if something changes with your profile, make sure you keep your resumes updated. Leaving out a critical piece of information, such as a new degree, could mean the difference between getting a call and not getting a call. One last tip of major importance. Remember to apply to other employers outside the federal government as well. If you're going to work in public health, be aware that every state, county, and city health department also has positions for public health employees, and they all advertise through their own websites. They, for the most part, use electronic application processes that are similar to usajobs.gov for accepting applications. If you are open to relocation, you will be surprised how many of these positions will grab your attention. In fact, if you're lucky enough to get a job in public health working at the state, county, or city level, that will make you even more marketable as a Fed in the future. So make sure you keep your options open and stay open to all those possibilities. Next slide, please. So let's talk about the interview process. Let's say that you've already finished up your application, and now you're sitting back and waiting. And now you're going to talk, you need to know a little bit about what the interview process is like and what to expect. Next slide, please. Most of the time, your first contact from a federal hiring agency is going to be by email. So it's critical that you make sure that your email address is up to date in USA Jobs profile. If it isn't, make sure that you're checking it constantly to keep a good email address in there. It would be a shame to miss an invitation to interview because you did not receive the email inviting you to do so. Sometimes candidates are contacted by phone, but this is really rare today, and usually the first contact is by email. Your first interview is typically a telephone screening interview, and it's generally conducted by a panel of 3 to 5 interviewers who will talk to you by teleconference because you have made that first cut in applying for the job that you're interested in. And generally, when this is happening, they are usually talking to only about the first top 10 candidates that apply. So if you're getting a telephone interview after that first application, consider yourself to be very lucky. The hiring office or agency looking to hire may elect to interview all 10 applicants, or they may just select the top 3 to 5. If you survive the next cut, you will most likely be invited to a second interview, and this is usually done in person, but it can be done by phone again. This usually indicates that you are one of only 2 or 3 of the top candidates that have made that final cut. Some agencies will travel you in for the interview at their expense. They will cover all transportation-related travel expenses, including your hotel and per diem, airfare, the whole 9 yards. They'll even give you a daily allowance for food and related travel expenses. All candidates will be asked the exact same questions during the second interview process as the rounds continue. Next slide, please. As you can see in this slide, the interview questions are usually fairly generic in nature. It is assumed that since you are being interviewed that you have the desire and necessary skills to do the job, otherwise they wouldn't be talking to you. So the interview panel is just trying to get a feel for how you speak, how you represent yourself, your level of maturity, your ability to carry on an educated conversation, etc. It's really more about getting a feel for what kind of person you are or whether or not others will be able to work with you and you with them. This will be a test of your personality and how well you carry yourself. Now, one word of caution here. If you are someone who is not comfortable with the interview process, whether it be by telephone or in person, I would begin seeking out help from someone like a career services advisor or mentor who can work with you to strengthen your interview skills. Getting past that first interview and onto the next one will depend on your ability to be conversational, demonstrate a certain level of confidence, and convincing the interviewers that you're someone that they would like to have as a peer. It is a very competitive process, so be aware of that. Next slide, please. Now we've come to the wait time after the interview. This is the toughest time of all. You have survived both rounds of the interviews, and now the wait begins. And believe me, it can be a killer of a wait. Just be aware that in most instances, even if you are the one that's been selected for the job after the interviews, you might not hear anything for weeks or even months. Once the selection is made, however, many wheels are set into motion, and they are all dependent on how busy the Human Resources Office is that handles your agency. A job offer will most likely be made by email first with a follow-up phone call after your acceptance. So again, make sure that your contact information is kept up to date. You do that in your profile and usajobs.gov. Next slide, please. What about the offer? Any offers of employment that are made will be consistent with the job announcement you applied for. So make sure you read the job announcement carefully. The announcement may state whether or not relocation expenses are covered, etc. So make sure you are judicious and stay informed. If your job offer does not cover all move and travel related expenses, those arrangements will be forthcoming from the agency, Human Resources Office, that makes you the job offer. I should say if it does cover those expenses. The offer will be coming from Human Resources, and they'll tell you what needs to be done. But you need to be aware of that there are some jobs that you may apply for, and it will be very, very clear in the announcement that moving expenses are not covered, so make sure that you read it carefully. Next slide, please. Let me tell you about a recent hire that we had at CDC that maybe some of you can relate to so you get an idea of who it is that we're looking for. The most recent one that I can think of was we hired a project officer to work in the immunization program, and he was a gentleman and had a master's in public health degree, and he was from the state of Oregon. He had been working as a state employee for about 8 years in the immunization program there, so he was what we were looking for relative to the type of experience base that he had. But more importantly, he had an MPH, and he was eager to come to work in Atlanta at CDC. It just so happened that I was on the interview panel, and I knew the individual because I had been the project officer for the state of Oregon, and I already knew who he was. So this was an example of knowing somebody that works at the agency that could, in fact, be helpful in getting you hired if they happen to be part of the process. I want to talk a little bit about that and the value of networking shortly. Anyway, I recognized this individual as someone that was a dynamite individual that would really add to the team that we're looking for to build in the capacity of project officer. He was very mature. He was in his mid-30s, a family man with 2 children, and he carried himself very professionally and very well. And the real selling point about him was that even though he had a primary job in his job at the Oregon Immunization Program, he also had taken the time to get trained, cross-trained in all the areas, the other areas of the program. So he was kind of like a jack of all trades and could move from one side of the program to the other and work in different positions and back up with other people as was necessary, which really made him attractive because as a project officer at CDC at headquarters in Atlanta, that's exactly the kind of experience that we're looking for that particular job. So the take-home story with this one is that make sure that you do some networking ahead of time. Make sure that you are trying to get as much experience as you can, even at the state level or city level or county level, if that's what it takes, because all of those things are going to be things that are going to weigh very heavily in a positive manner when we look at your resumes and are thinking about hiring you at CDC. So let's talk a little bit about the value of networking and making contacts. Lisa?
Great. Thank you for sharing that story, Jack. So as you mentioned, we're going to be talking about networking next. But before we get to that, Dina, would you like to run the next poll?
Absolutely, Lisa. Let's find out a little bit more about our audience. How are you building your network? What is the top way you are building your network? Is it through volunteering, internally at work, externally through professional organizations, through LinkedIn, or what time for networking? Let's see what our audience says. And we'll just give it a minute so the results can come in, and then we'll share the results.
And I know our students are balancing a lot of balls in the air in terms of work and family and school, and so probably that what time for networking, that's probably what it feels like oftentimes.
And some people did say what time for networking, 14%, but a majority of people said volunteering. 43% said volunteering. And also externally through professional organizations, through LinkedIn, and also internally at work. So many of our students are networking effectively.
Great. Thank you, Dina. And actually, we have a question about one of these ways of networking, Jack. And the question is, do government agencies take on volunteers? Because one student said that they had applied to various agencies and they were having trouble breaking into volunteer opportunities with the government, with the federal government.
Well, the answer to that is yes, and it really depends on the agency and what it is that they're looking for in the way of volunteers. At the CDC, we do take volunteers, and because we do have people that are co-located, all state health departments throughout the United States, and we even have people overseas, we are looking for people that are willing to do stuff like that in places other than Atlanta at headquarters. So the answer is yes, it really just depends on the agency and the type of work that it is that they do. As you can imagine, there are some programs and some of our agencies that are involved in the type of work that is considered to be classified information, and as such, they would not be able to take volunteers. But in an organization like ours, where we have essentially access to all public health issues on a nationwide scale and around the world, very little of what we do is actually classified. It's public domain stuff. So they would be highly desirable in our agency for sure.
And those opportunities would be advertised in USA Jobs? Is that correct?
No, volunteer jobs are not advertised anywhere. They have to just become known by knowing someone within an agency, or perhaps through a consulting firm that does business with one of the agencies. We have a lot of contractors that send us part-time employees that are people that are interested in getting some experience in public health, so they hire them as a contractor, so we bring them aboard and give them different experiences. In addition to that, we also have fellowship programs where we get a lot of fellows from across the country from different public health programs and organizations that want to supply us with free help, and the student in turn gets credit for being with the agency and learning what we teach them.
Excellent. Thank you for sharing that. Okay, I think we're ready to move on to networking.
Okay, so let's talk a little bit about networking so you know what we're talking about and how important it is. Networking in any field is very important to your career, particularly when you are first starting out. Some federal agencies will ask you for references before they make you an offer of employment, while others will wait until after the offer. Be prepared to submit at least 3 to 5 references. Make sure you have a good substantial references who will support you in a positive manner. A Word document with your name and the title references should include your references' full names, their titles, their telephone numbers, which will be both cell and landlines, and their email addresses. Rarely do agencies ask for mailing addresses, but you better have them just in case. Your references should be pertinent. Make sure that you start networking now so that you begin to gather contacts that actually work in the field of public health. Hiring agencies are going to want to speak with those contacts that can speak to your knowledge, your skills, and abilities, especially as they relate to the public health arena. Valuable references may be anyone who works at the federal, state, county, or city level, in addition to individuals who are familiar with your work in other industries. It is always a good idea of steering clear of friends and focus on at least 1 peer and 2 supervisors who are intimately familiar with your background and skill set. Now remember that I said that when you're building a reference list, steer clear of using friends and focus your attention on at least 1 peer and 2 supervisors. The bottom line with networking is be proactive, be outgoing, be ambitious. Take some initiative to stand out from the crowd in some way. This will make you a better candidate for employment, increasing your chances of getting hired much quicker than those who not take this part of job finding a job seriously. Many a job offer has never been received because of lukewarm references or a bad reference. Make sure you take significant time to speak with each of your references so they can give you personal permission to use them and ensure you in your own mind that they know what your goals are so they can speak better on your behalf. Next slide, please. So in closing, let me emphasize the importance of staying current regarding what is happening in the public health industry. Public health is just like any other industry where it is forever changing and moving in new directions. To stay on top of those new directions, make sure you are diligent in conducting research, do a lot of reading of professional public health literature, and by all means, seek out new avenues of potential information. This is what will keep you well informed and ready for that first interview. Next slide, please. And with that, we're ready for questions.
Great, thank you, Jack. Our first question is from a PhD student in epidemiology who asks, what chances do we have to gain full employment or an internship with a federal public health agency? And for example, which agencies could you direct us to that would accept and look into our applications? Do you know any that might be hiring beyond CDC at this point, Jack? Or HHS, say?
Well, at this time, I know that CDC is always looking for epidemiologists with a doctorate. We can never get enough of them, and there's always probably a dozen openings on usajobs.gov for epidemiologists to come to headquarters at CDC in Atlanta. but we also need epidemiologists to work out in the states as well. And we have a lot of need for epidemiologists that work outside of the country. People that would go and work with other sister agencies like the World Health Organization and places like that. Without looking at the job announcements today, I couldn't tell you whether or not anybody at any of the other public health agencies are seeking epidemiologists, but I'll be quite frankly surprised if they aren't. That seems to be one of the areas that we really are always looking for help and can't seem to find enough qualified people.
Okay, terrific. Thank you. Another question, what options are available for positions for someone with a PhD in public policy and administration with a health policy specialty? Do you need to have that degree in public health to work in public health?
Well, we do have a lot of people on staff that are in policy jobs, and in fact, just to give you an example of how CDC is constructed and how we're built organizationally, every one of our divisions has a policy person. They generally are hired in at the GS 13 or 14 level with either a master's and or a doctorate. So we have lots of jobs for policy people if that's kind of your work that you're interested in. And yes, we do hire people that have a doctorate in policy, but you would be really marketable for public health if you also had the MPH. Most of the people that we do hire have both. They have an MPH and they have further education, and usually a doctorate in public administration or some other area that we use for policy. So again, it all depends on which agency you apply to, but at CDC, you'd have a good chance of getting hiring just with the policy degree.
Great, thank you. There are several questions here. Any ideas on how someone who is an international graduate who might want to work in the United States might be able to apply for positions? Or do you need to be a U.S. citizen? How does that work?
Typically to work for a U.S. government agency, you generally have to be a U.S. citizen, yes. However, if you are able to get a green card and get a work permit to come into the United States and work, or get a special working visa, of which there are many different kinds for students and other people that have special skills, it is possible that you can still come to work for one of our government agencies, including the CDC, because you could get hired by a contractor. There are many public health agency contractors out there that hire people that fall into that category that we're discussing. And what they do is they hire them, and then we hire the contractor to send them to have them come work for us. So yes, the possibility exists, and we have a lot of people that fit that description, especially people that are interested in doing fellowships.
Great, terrific. And are there opportunities for PhD in health psychology in the areas of research?
You know, that's one that I'm not familiar with. At CDC, I'm not aware that we hire anybody in health psychology, and I'm not well versed enough with the other agencies to know whether or not anybody would be interested in seeing someone with that type of credential. So I'd have to say that I really don't know.
Okay, great. So the best thing would be to check USA Jobs and see what the qualifications are.
Yeah, and probably do something that would be, do a search that's related to psychology in some way and see what pops up, because there are so many different ways to do a search. I'd really be surprised if something didn't come up. You got to remember also that for people that have backgrounds in psychology and nursing, physicians, people that may not necessarily be just public health types but could work in public health, there also is a wide array of opportunity out there on usajobs.gov, working for the military and Department of Defense, or working for any of the individual services. The Veterans Administration hires a lot of people with those types of job skills and degrees. So I mean, the playing field is wide open.
Great. One student asked, does USA Jobs allow for the opportunity to submit cover letters with an application?
Yes, it does. In addition to actually building the resume in there, what it does is it will actually ask you to download your resume, and depending on the agency that's using usajobs.gov, sometimes those just suck up out of your resume all the key points from your resume, like your name, address, degrees, and stuff like that. And then you just kind of go in and fill in the rest of the blanks. But then you also have the ability at the end of the building your resume process, before you finalize all of it, they'll ask you if you want to download any documents in support of who you are, which includes a cover letter, the actual resume itself that you're working from, or resumes if you've got more than one. You also can download documents such as your DD-214s, your honorable discharge certificates if you're a veteran, virtually, and then there's another category for putting anything else in there that you think is of importance. So yes, it can accommodate virtually downloading any document, but what you need to know about that is that most agencies only want specific information. Sometimes there's such a thing as going overboard and overloading them with information that they really don't want to see. But then again, there may be a good reason to provide them with extra information that they are not aware of, simply because it may be that one thing that makes you head and shoulders above everybody else. It makes the difference between getting a call for an interview and not getting it. So that's going to be a judgment call on the part of the individual, but the option is there.
Great. We've got so many questions. I don't think we're going to be able to get to them all, but we'll take a few more here. You've mentioned government contractors several times, and how does one find out about those government contractors and who they might have relationships with if they submit applicants to agencies like CDC?
Well, all government contractors, for the most part, are consulting firms. So if you do a web search looking for public health consultants, that typically is going to bring up a bunch of hits that are going to be people that are in that business, and some of them are going to be nationwide in scope, some of them are going to be international in scope, some of them are going to be regional in scope. So depending on where you want to work and what you do will depend on which one of those sites that you access. And just like most people who are looking to hire people, your first contact with them will be probably by submitting an online application through their electronic system. And sometimes they provide you with a telephone call where you can actually talk to somebody that works within that consulting firm. But that would be a good first start, would be to do a web search on public health consulting firms, see what kind of information pops up, and then start contacting them to see what kind of jobs they have available for you.
Great, thank you. This question has come up several times, so I definitely want to pose this one to you. How does one find a mentor if they aren't well connected in the field yet? Any ideas on that? Because several students have posed that question.
The easiest way is to join professional organizations that are specific to public health. For example, the biggest one and most widely known is the American Public Health Association, the APHA. All states and most major cities have a student chapter, and you can find that online by going to their website. And that would be the first thing that I would do. And I would join them and find out when their next local meeting is going to be, and I would go and start meeting people there. That's how you get known. That's how you get to shake hands, win friends, and influence people. That would be the starting point, would be the American Public Health Association. Other professional organizations also that you need to be aware of are places like ASTO, the Association of Territorial Health Officers, and NACHO, which is the Organization for County and City Health Officers. It's called the National Association of County and City Health Officers, NACHO. All of these organizations, professional public health organizations that are there just for this purpose, for networking and for helping out in public health for a lot of different reasons. They're located all over the country. All you have to do is join and go to a meeting. Before you know it, you'll be meeting all kinds of people and making friends and making all kinds of contacts.
Great. We've received two questions regarding nursing. So one student asked, what about nurse practitioners? The other one, what types of jobs are available for a registered nurse or a nurse practitioner with a PhD in public health? And what is the best way to transition from nursing to public health?
Well, believe it or not, we love nurses. We hire all kinds of nurses, particularly ones that have, in addition to being either an LPN or an RN, We love them if they've got an MPH or a doctorate in public health. Tons of jobs available for them just at CDC. I have 2 nurses that work for me as nurse health educators. And what they do is they work with the immunization program. And since I'm working in the education shop where we're responsible for all nationwide education across the United States that's immunization specific, I've got a staff of 30 people that work for me, of doctors and nurses, and 2 of them happen to be registered nurses that are on my travel team. And what they do is they travel around the United States giving seminars and attending conferences and being guest speakers and giving lectures on the importance of immunization, how to properly immunize. But all the other programs that we have also do the same thing. Another option that people might want to consider if you haven't looked into this, particularly if you're a nurse or if you're a nurse practitioner, a very valuable option that you want to definitely check out is that of joining the United States Public Health Service as a commissioned corps officer. The United States Public Health Service are people that fall under the auspices of the Surgeon General's office out of the U.S. Department of Health and Human Services in D.C. And we call them commissioned corps officers. They wear the U.S. Navy uniform, same uniform that the Navy wears. And they're commissioned officers. And if you join the Public Health Service Corps, depending on what your education level and your experience is, will depend on what pay grade rank they bring you in. But that could be a real exciting option for people who have not considered that also. They have a website like everybody else does. Just do a web search for United States Public Health Service, and their site will pop up, and it'll tell you what all the opportunities are, how to contact a recruiter, how to apply, the whole 9 yards is right there. So the long answer and the short answer is yes, we love nurses. We hire lots of them.
Great. And I'm going to take one more question. What kind of status is retired military service? Can you speak to that?
That's a special hiring path. You would be treated and given the same precedence as a veteran.
Got it. Okay, terrific. Great. Well, thank you. It was wonderful to get so many questions. It was terrific. The students are really engaged in this webinar. That's been great to see. So,
right. Well, thank you very much to everybody who participated tonight. I hope that we answered the majority of your questions. And again, we're very happy to have you participate in this particular conference tonight. And I'll turn it back to Lisa. Thank you very much for your attention.
Thank you so much, Jack. It was wonderful. Excellent information and very, very useful. And we really appreciate your presenting this evening. So I'm just going to run through a few additional resource slides quickly just so you know what other resources are available through the Career Services Center. We have just launched a new resource called Optimal Resume. We launched it the 1st of August, and we're up to 300 users on that system. You'll see it's the second blue button on the left there. And if you haven't checked out the system, you might want to do so. It might be helpful in developing a resume which could serve as the basis for your federal resume. So you might want to take a peek at that. You're familiar with our webinar series. As we mentioned, this webinar will be archived within 2 weeks of this program. If you haven't joined our Walden University LinkedIn group, that's on our next slide, we've just reached the 600 member mark for that group. We're really thrilled about that. We highly recommend that you participate in this group in terms of building your professional network. As Jack mentioned, networking is just such an instrumental career development tool. It's a great way to find a position, to gain information on trends in your field. And so this is a great way to instantly add 599 people to your professional network, both Walden students and alumni. And the question was asked, what professional associations would be good to join that are health related? That's on our next slide. That would include, I think we'll go to the next one after that. There it is. American Public Health Association, the Association for Professionals in Infectious Disease and Epidemiology, American Association for Health Education, and the National Environmental Health Association. In addition, on the next slide, we have listed job boards and sites related to public health, so you can see those. They're also listed on our website. Next slide, please. Emory's Public Health Job Connection has a number of job listings. You've got the CDC website there. Also, an APHA campaign website for the public to heighten awareness about the importance of public health. Next slide, please. And then, as we mentioned, other LinkedIn groups. There's the site for APHA. You can see it has 15,000 members. I always look at the size of a LinkedIn group in deciding whether to join. I figure the bigger the group, the better the group in terms of the types of discussions I'm going to be seeing going on there. And just the fact that they've been able to recruit 15,000 members shows that it's a pretty substantial group. So I would definitely recommend that. And also, Patty Carlson and Tony Capello were featured on our most recent webinar, as I mentioned, on public health career opportunities, and they're involved in that group. Next slide, please. There's the Global Public Health LinkedIn group. Next slide. And then a whole bunch of them listed on this slide. And the reason that we put these together is we want to make it easy for you to find some good resources. So just remember, when this webinar is archived, the slides will be available. You'll be able to print these out. So they'll be at your disposal. And then with that, we are going to close the webinar. So thank you so much for participating. Thanks to Jack for presenting. Excellent content that he developed, and just really some good practical tips. And just a quote to leave you with: for the person who has health has hope, and the person who has hope has everything. So we so appreciate the work that Jack and other public health professionals do throughout the world. So thank you very much for participating, and have a great evening.